So today is my second day after the knee surgery. As I mentioned in the first video, I tore my ligament, the ACL, the meniscus, and the lateral. Um, so I was lucky to have my orthopedic, surgeon to schedule the surgery 2 weeks after my injury. Um, Going to, the surgery is a nervous experience. It is my first major surgery. Um, a lot of things, went to my mind, before the surgery, anxiety, mostly anxiety. Um, I had, a wonderful experience, as a patient at the hospital, in pre-op area, operation room, and recovery. Um, I also, got, the nerve block in my knee, so it helps with the pain a lot after the surgery. Um, so I was taken home, and I I still, had the nerve, block, effect in my knee. So even though I was under, the drugs, influence, I kind of felt that this may be a piece of cake, um, but I was wrong. Like on the night, couple hours, like on the night of the surgery, I I got a surgery, in the morning at 7:30 a.m. and I was taken out of the room around 12:30. So it's about like almost 5 hours, surgery. So on that night, I woke up. I felt, like alert and oriented around 11:30 p.m. The nerve, block started to wear off, and I gotta tell you, that's when the reality, hit me. I was in so much pain. Um, it's a constant, sharping pain, um, just like someone, yank your knee out of the socket, and um, and then somebody just, like drilling, something on your bone. Honestly, that's what had happened. I got, two screw, in my bone that, the surgeon has to uh, drill the holes to anchor the ligaments. Um, I was like that all night. I took, Narco, and didn't hit me much. Yeah. Um, just toss and turn and just suffer, with the pain. Um, and my leg, was so swollen. And every move, even just, the light touch, of the blanket hurt me so much. Um, and then the following day, it got a little bit, better, still in a lot of pain. Um, I added, Tylenol, to the medication. I'm not a medication guy. I try to take, the less, the better. But with this, I gotta tell you, stay on top of your pain medication. Set, the alarm. So even though, when you are sleeping, the alarm would wake you up so you could take, your pain medication. don't wait until the pain start to get intense and you take the medication. um, it may not give you the most benefit like that. So so second days after the surgery, um, is is a little bit better now. I'm able to drag myself um, just one direction, like straight forward and backward, very, very slowly. Um, I stay, on bed since then. Yeah. A lot of frustration, anxiety, upset, uh, because basically, I cannot do anything else. Um, I got to depend on my mom, completely, from like bringing me like toothbrush, water to wash my face, um, even food. um, so is quite an experience for me. um, and it is some is it makes me really appreciate my mom. Yeah. This this suck. Yeah. I hope that just a couple of days when the swelling subsides, I'm able to move more, and I could stand up, use crutches to at least go to the restroom, to take the pressure off my back and my tailbone. I'll tell you, stay on bed for even 2 hours, like it hurt. I just shift myself, like left, right, um, to take the pressure off the back. Yeah. um, really trying to stay positive here. um, so I'll update you guys how it goes. And I took the ACE wrap off, and I felt so much better, such a relief in the pressure on my leg. Of course, you only do that with the clearance of your orthopedic surgeon.